Hi, good morning again, everyone. Mics make me nervous, so but I'll try to make sense. So I'll be presenting today on HIV in Barbados. I am not Barbadian, as you might have heard in the introduction, but I have been living in Barbados for 12 years, and I think we have a close, intimate working relationship. And for those of you who don't know, Barbados is a small Eastern Caribbean island, just 431 square kilometers, with about 285,000 persons. The capital is Bridgetown, and about more than half of the population lives in rural areas. Our first case of HIV was diagnosed in 1984, and we presently have around 2,600 persons living with HIV those are 2016 data. The prevalence among 5 to 49-year-olds is about 1.6%. The prevalence in MSMs is 11.8. There's a possibility that the prevalence is higher in female sex workers and transgender persons, but we don't have any evidence to back this up as yet. With regards to us meeting our 1990 targets, we are at 83.4% diagnosed, 50.9% in treatment. That number might actually be higher because I think that's 2013 data, and 84.7% virally suppressed. So we're getting there. The National HIV/AIDS Commission, or NHAC, was born in 2001, and it's what coordinates the Barbados National AIDS Program. The cornerstone of the program is the Lady Mead Reference Unit, or the LRU, and the Lady Mead Reference Laboratory, or LRL, and they came on board in 2002. The LRU is a national treatment center, and it offers testing services, HIV and STI management, family counseling, medication adherence counseling, psychosocial support services, nutritional support, HIV food bank. The laboratory is internationally accredited and includes CD4 and viral load testing, as well as pharmacy services. And in the background, you can see a faint picture of the LRU. The Ministry of Health and Wellness has been using a treat-all approach since 2016, so we offer ART to everyone who is diagnosed with HIV. In terms of care retention, 49% have been retained in care if you look at the persons who have been diagnosed. But if you look at those who have been linked to care, care retention increases to 79%. The Ministry of Health and Wellness also utilizes a shared care model, whereby the majority of treatment and care goes on at the LRU, but we also outsource care to certain private practitioners, private medical doctors, some community-based organizations such as the Barbados Family Planning Association, and some polyclinics, and those are for uncomplicated cases. So I just wanted to share quickly with you our success story, which I think are two aspects that are closely intertwined: the provision of PrEP and a CSO engagement strategy. So Barbados, recognizing that PrEP is an essential part of prevention services, and under the excellent stewardship of our Senior Medical Officer of Health and head of the HIV and STI program, Dr. Anton Best, started offering free PrEP in March of this year at the LRU. The guidelines that we follow are taken from the CDC and the WHO recommendations, and basically PrEP may be offered to any person in Barbados who is deemed to be at substantial risk for HIV. We've had more than 30 persons enrolled so far, but we don't have PrEP clinic every week, so it's kind of sporadic because of the competition with regular care. This is just an overview of our indications that we use, which, as I said, closely follow CDC, WHO. But you have to be an adult person over 18 years old who is also HIV negative with no suspicion of acute HIV infection, and at least one of the following in the last 6 months: is in an ongoing sexual relationship with an HIV positive partner who is not suppressed, is an MSM engaging in unprotected anal sex with another man, is a transgender person engaging in unprotected sex, exchanges sex for money or goods and engages in unprotected sex, is an MSM transgender person or a person who exchanges sex for money or goods with a diagnosed or reported STI, has unprotected sex with one or more partners of unknown HIV status who are known or believed to be at substantial risk of HIV infection, or within the last 6 months you've had PEP for sexual exposure. I should add that our guidelines do make provision for the fact that if you don't meet these, the criteria at the bottom, not the one in the blue, but you are requesting PrEP, we will give consideration to providing it for you for the mere fact that you are requesting it. And our CSO engagement strategy, as you may know, to reach the 1990 goals, the governments can't do it alone. The governments can't test everybody. There are logistics involved in getting to government testing, and there's a problem with stigmatization. So the government has recognized that they need to partner with community-based organizations. The WHO has recommended this as well. And it's also recognized on the other end, whereby persons who can benefit from this, such as key populations, have said that they prefer to access care privately or via community-based organizations. We did PrEP focus groups, and this was also confirmed. I should say the ICT stock-taking survey was a survey done online. So presently we have a CSO engagement strategy between the Ministry of Health and Wellness and two CSOs, Equals and SEED. I'm a board member of Equals, and I also do their volunteer medical clinic. And this is being facilitated by Linkages, which is a program that's being run by FHI 360. I think with funding from PEPFAR and USAID. And we are focusing on three aspects: shared care, PrEP provision, and HIV testing services. So shared care will be similar to the model that the government currently employs with the Barbados Family Planning Association. Our PrEP provision at Equals and SEED will start in January. And our HIV testing services, we've started the process of getting some of our staff certified for this, and should start shortly as well. And that's it. Thank you.